Welcome to Wayward Writers. We're very excited today to have with us Dr. Erica Patton, who is a chiropractor and is going to teach us lots of stuff about self-care. So, Nikki, will you introduce Dr. Patton to us?
Absolutely. Dr. Erica Patton is actually my chiropractor, so I'm thrilled that she's with us today. And a little bit about her. She was born and raised in Pittsburgh, Kansas. She moved to Missouri to attend undergrad at Lindenwood University, where she earned a Bachelor's of Science degree in biology. Following undergrad, she went on to attend Logan University, earning a second bachelor's degree in human biology and her doctorate in chiropractic. While at Logan, she met her husband, Ryan, and they got married in 2017. And then in 2021, they welcomed their first little one, Isla, who is often seen running the show at Dr. Patton's chiropractic clinic. And I can definitely vouch for that. She is a doctor in the making for sure. She's adorable.
Yeah.
So Dr. Erica just feels like finding the balance of being a working mom has been a challenge, as many of us know. But thankfully, she's had the most wonderful patients who understand and accept that her little helper goes to work with her. Mm-hmm. The funniest part is if she is not there, everyone's first question, including mine, is, where is Isla? So it's easy to tell that her presence brings joy. In her free time, she likes to go camping with her family and friends, read, nap, and start crafts and projects that unfortunately rarely get finished.
It's so real. It's so real.
Very real. That is the truth. So welcome. We're so glad you could be with us today.
Thank you. Thank you for having me. I appreciate
it. The reason why we wanted to have Erica with us is to talk about all the many things, obviously, we talk about here in writing. And one of them is self-care for ourselves physically through stretches. We spend a lot of the time at a desk and a computer or writing, hunched over our work. And she's here to kind of make those things be more comfortable and healthy for us. So, Erica, what are some of the most common challenges in your practice of people who spend a lot of time at their desk and computer?
Hands down, people who work at a desk computer, or even students who are studying a lot, is upper back tension, headaches, neck pain, sometimes jaw discomfort from all of that being just a little wound up. But headaches, neck pain, upper back pain is a really big one that I see in office on a daily basis for people who have more of a sedentary job that they do.
Okay, so what are some of the things that a chiropractor can do, and also what we can do self-care wise?
So chiropractic care, what I'm so passionate about, if I can give you a little brief history on that, is my first migraine headache, I was in first grade and I had no idea what was going on. It was miserable. I loved reading and it was reading time and I didn't want to read and I knew something was wrong. And long story short, the only thing that I got relief from was chiropractic adjustments. And so from about third grade on, I was like, I think I want to be a chiropractor. So I really kept that like in the back of my mind as I pursued coursework through high school and going to attend college and everything. And it's because when you have an imbalance of muscle tension or restrictions of the joints and the spine, it impedes nerve flow. So if we're not getting those nerves functioning, it can cause headaches. It can cause the muscle tension. It's kind of circle of life kind of thing. Figure out, is the muscle tension causing this or is this causing the muscle tension? But overall, just getting everything to talk together, I feel like is really important for people to find that balance. You're always going to hear me talk about finding the balance, whether it's in life or in the body. We need to find our balance. So a big thing I see a lot of is cross syndrome. So this is if I'm sitting this way and you draw kind of an X through my profile. A lot of us have really tight upper trap muscles. So coming through the top of the shoulders up into the neck and really tight pecs. Because when we're sitting at our computer, we start the day and we're like, we're going to have great posture all day long. And then your eyes get tired and then you get tired and you start leaning in and everything just starts wanting to curl in. So these are tight and these are tight. Whereas the mid-back muscles, the rhomboids and the serratus anterior muscles, they're offline, and the neck muscles up here. So your deep neck flexors offline. So chiropractic care can help by adjusting the spine. So making sure there's no restrictions of the cervical spine or even thoracic spine anywhere else in the body to get the nerve flowing properly. and to help correct those musculature imbalances to make sure we do feel our best when we're working at the computer or writing and stuff like that.
That's awesome. Okay, so if someone doesn't have a chiropractor, or if they're at home and they need a quick, oh my goodness, I need a little adjustment or something like that, and, they're by themselves, what are some things that you would recommend that we do regularly?
I will never recommend somebody self-adjust. So that kind of thing. People do it. I get that. We're human. Not my recommendation. But there are stretches that you can do. So do you guys ever just drop ear to shoulder, try to stretch through the neck here? So to get a deeper stretch when you're doing that, I like to take one hand. You can't really see my chair, but I'm going to grab the bottom of the chair I'm sitting in and pull this shoulder down. You're going to take the other hand and pull the head away. So this is going to give you that same stretch through the neck here, but it's going to be deeper. You're going to be able to feel it stretch a lot more. And then I like to look down towards the opposite armpit, come to the back of the head and pull down that way, and you'll feel it down the back of the neck. So you're able to get a really good stretch through the neck that way. A way to stretch out these really tight muscles through the shoulders. You're going to make an L. I don't have a door frame right here, but typically I'll tell patients just to go into a door frame or a corner of a wall. And what you want to do is you want to place this arm up against the door frame and then lean into that. And as you lean into that, keeping this arm parallel to the ground, it's going to stretch out the pec muscle that sits right through here to help this loosen up. So that's going to be a really good start. Typically with patients, everybody's different, so I don't one size fits all their care. But typically I recommend let's start stretching, getting those muscles start cooperating that way before we start strengthening the deep neck flexors and the serratus anterior and the rhomboids back through here. I can show you those ones too if you're interested.
Yeah, let's definitely get to those. And just for those of you that are viewers that are listening or watching, or hopefully if you're in your car, you're not watching, you're just listening. But we've been doing these muscles, and you'll put all this in the show notes. So please don't, hurt yourself or get in a dangerous situation.
Stay safe. Yeah, stay safe.
But we will definitely share those. But yeah, we definitely want to hear some more of the stretches. What are there the couple other that you were talking about? On the So
to strengthen the upper back, the upper traps and the levator scapulas are the tight ones. Those are what we're going to be doing these stretches with. To strengthen the mid back, so more between the shoulder blades. Do you ever get like that knot there? You can go up against a wall, or you don't have to be against a wall, but you're going to make shape like this. And as you bring your arms down, you want to make sure you keep the shoulders back. And then you want to imagine you're pinching a pencil between those shoulder blades. So what this is going to do is it's going to activate those muscles of the mid back and get them online. So as you do this, it's all very slow, controlled motions. And I typically recommend 10 to 15 reps, and then take a break. Some people are going to be able to handle a little bit more, some people not as much. And that's why it's important to listen to your body when you're doing these stretches, because what might work for one patient might not work for another. And that's okay. We're all different, and we all have different jobs and hobbies and lifestyles that we have to find what works for us. The deep back flexors is a fun one. I like to call it my chicken exercise, because the goal very much isn't to raise the head up this way, but to come forward. So I would try to do this sideways, see if you can see it. So you want to imagine, I typically like to recommend a patient lying down so they can come up towards the ceiling, but you're going to bring forward. And then no woman likes to hear this, but our goal is to give ourselves a double chin when we do this. So forward and forward. So that nice, glorious double chin that we're always trying to hide. And what that does is it gets these muscles online as well. So for all of the computer work, writing, anything where this is all tight, it's going to help get everything balanced and start working together, talking and communicating in the body a little bit better.
Okay, great.
Those sound really good.
And
that sounds really good.
A lot,
but you remind me of my yoga teacher. It sounds very similar. It's like,
yes.
Yeah.
The thing is, it sounds like a lot right now because I'm just spewing the information, but little by little, like I said, typically I'll recommend, okay, we're going to stretch the pecs and we're going to stretch the neck.
Okay, start there.
And then as that starts to, and then I'll give a couple more. I 5, 6, 7 exercises at someone at once because we're busy people. It's not always going to be feasible to do all those exercises at once. So I start with 1 or 2, let the body adapt, and we move on from there.
And do you recommend that this is something you could like pause during the middle of your day or something? Like partway through and do that? Or
Absolutely. Especially so if you guys are like on a roll writing, you've been for 4 or 5 hours and you have this creative flow going.
Yeah.
I'm not going to tell you to stop doing that because I'm sure stopping and then getting back into it is tricky. But if you can manage, and this goes for anybody who works at a desk job or a student who's studying a lot, 10 minutes every hour is great just to get up and move the body. If we sit for too long, not even focusing on the issues of the upper body, which comes from working at a computer a lot, but the body doesn't like it. We're designed to move. So if you're doing something where maybe you are writing, you could stop for 30, 60 seconds and do your upper trap stretches here. Especially if you're sitting in a chair that has a good bottom that you can grip on. So do those stretches, look all the directions, and that counts as not really having to stop what you're doing, but still incorporating that self-care while you're doing it. It's a lot of just making a habit of it though, which is easier said than done.
Yeah.
Are there other things that we should be aware of? You talked a little bit about posture, and I know that by the end of the day, I'm like, done.
Yeah.
Are there others?
Yes. My favorite tip, it seems to be 50-50 split, whether or not people have heard of this or not. I'm actually not following it right now. I don't know if you can tell. I'm kind of looking down at my computer, and realistically, we want at least the monitor at eye level. But as we're looking down, trying to remember this statistic off the top of my head, every inch forward that our neck comes, I believe is an extra like 10 pounds of pressure on the spine.
Oh.
So as we're doing this all day long, no wonder our neck hurts and we're getting headaches and everything. So if we keep the monitor up, we're looking straight at it. At least this way, if we start to get tired and we start to come into it, we're not going to be looking down as we do it. It's a little trickier if you have a laptop, because nobody wants to type up here by their face while they're doing it. But that is typically a pretty easy solution if you can just get like a Bluetooth keyboard or something to go with that. So you can keep your keyboard down to where you can stay like this, but the head comes up and you're looking straight onto the monitor instead of down at it, putting a lot of extra strain and pressure on the spine and the nerves and the muscles and everything coming through there.
That's good to know. That's actually an easy fix. That would,
That's typically I tell people, I'm like, if you have Amazon boxes or textbooks, you're good. Yeah. Take a couple of those and you can get it right on up where you need it.
Textbook. I miss
that. Yeah. The good old days.
Textbook.
Mine were only about this big at school, so no big deal.
Oh, that's hilarious. Okay, so when is my body telling my muse enough is enough? Is it just when my body's telling me that? Like, just listen to my body, you said, and when I've overdone it for whatever reason, then...
That's a trickier question because, like I mentioned before, person A is different from person B. You can have the same exact jobs, you can have the same exact diagnosis, but your lifestyles are different or your hobbies are different. Things are going to be different. No two people are the same. Typically, chiropractic care is not just for pain relief, but that's why I get a lot of patients in, is starting with pain relief. And then I try to get them to this every 4, 6, 8 weeks maintenance to make sure the body is just listening to what they need. Big indication, more than just the muscle tightness, if you start to have any, what we call radiation. So if you have pain coming down the arm or into the hands and wrists, if you have a numbness, a tingling, that's going to be a really good indication for everybody that something needs to be seen, because typically with that, it's either a restriction of the joints, putting pressure on those nerves. So we're not getting all that nerve flow and you're just feeling this weirdness coming down the arms, or even sometimes tight muscles can cause those nerves to get a little flow on us. So radiation is going to be a really big one that if someone is dealing with that, then you've done too much. Let's check it out. Let's get that fixed for you. But more than anything, like I said, since everyone is so individual, and I don't believe chiropractic care is one size fits all. I believe it's for everybody, but you need to take it on a patient by patient basis. Then it's best just to listen to your body. If something starts coming up and you're like, I didn't have this a week ago and it's not going away, let's get it checked out. Let's get it taken care of. If you slept wrong, that happens so much. I turned 30 and I was like, I did not realize this was a thing, and this is a thing now. So you sleep wrong, you come in. Sometimes it does just take 1 or 2 visits and you're good to go. Other times it is more of an underlying cause from repetition in the body, what we're doing that requires a little bit more looking into and a little bit longer care before we can get to this maintenance visit.
You mentioned in a recording that there was something about essential oils that you use that help us. Could you tell us more about that? I'm interested in that.
Yes,
I think they smell good.
I'm a nerd for essential oils. I started using them, I believe it was my second year. It was before I went into clinic in undergrad. And it was, of course, one of those, I'm like, this is a multi-level marketing team, blah, 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 blah. I ended up using doTERRA, and I love their products. Not only are they good, they are more on the expensive side because of the quality of them, but I trust recommending them to patients, and I trust using them on my little one. I used them on my infant when she was just a couple months old. If she was having tummy troubles or stuff, they're very safe to use, and they're third-party tested, which is awesome. Not all companies can say that. So they send their batches out and all of their oils are tested. My favorite oil, I brought some with me. I'm going to see if my camera will pick them up. Is everyone familiar with the gifts baby Jesus got in the Bible?
Yes.
Gold, frankincense, and myrrh. So frankincense, see if we can see that little guy. It is referenced as the king of oils because it does everything. Nikki can attest to this. I have recommended her using frankincense for her and her family on multiple occasions. And what I like about it is mainly I recommend it because it's a really good natural anti-inflammatory. So I think it smells really good. Some people think it's a little strong, but it's an anti-inflammatory. It's an antibacterial. It's an anti-parasitic. It's an anti-cancer, antiviral. It's literally the king of oils. If I had to recommend one patient pick an oil, it would be frankincense because of the anti-inflammation properties. As far as muscle tension, my favorite is peppermint. So this one, it's also really good for nausea or upset stomach. So back in 2020, when we all had to wear masks, I was pregnant with my first little one, put a drop of this on my mask, world of different. So peppermint's really good to get those muscles to calm down. And do you ever eat a peppermint candy if you have an upset stomach, calm things down? It's really good for that. And I would say my third favorite that I typically like to recommend to patients based on what they're coming in with is lavender. There's my lavender. It just smells delightful, and it is actually a natural sedative. So if we're feeling stressed out, put a few drops in the bath, let your body take those scents in. Once again, I don't remember the statistics off the top of my head. I believe it's within 20 seconds, but definitely under 1 minute. If you're using essential oils topically, it is within every cell of the body. So they work super fast, super effective, especially if you have a good quality brand. I'm not going to speak about any other brands. I don't have any history using them, but I 100% would recommend doTERRA because they've never let me down with their quality or any issues with that. So those are my three favorite. I definitely have other ones that I use. I have a bunch that I've only used once, but I'm like, I need this oil. And they don't expire.
When you use the frankincense, what do you do? Do you rub it on yourself?
So let me find.
You said it's
I have no clue anything about
you
this
said it's anti-inflammatory. So do you use rub it on if your hands are sore? What?
Yep.
I'm with you, Heather. I want to know. I need to know.
Yes, absolutely. And so with essential oils, I tell patients to test. Some people have really sensitive skin. Some people can handle it no problem. I've gotten to the point most oils, unless it's a hot oil, so like oregano, which has a lot of really good properties, that is one that I 100% will dilute down. But most oils I can put on what they call neat. So I don't need a carrier oil. I would recommend if you're starting with oils, get a fractionated coconut oil. So it's coconut oil that doesn't solidify it. I don't know how they do it, but I would start with that and then use the oils with it just until you can determine what your skin can handle. But I'm going to once again try to see if my camera will pick up. So Do you see that says supplement facts? So this is frankincense. And what I like about doTERRA is they give you a cheat sheet on whether or not you can take an oil internally. So you could do frankincense. I have a cousin who gave me a trick. If you have a migraine, put a drop on your thumb and put it up against the roof of your mouth and let the frankincense just do its thing. So you can take that internally. You can put it on topically. You can get a diffuser and you can use it aromatically. Here I have tea tree oil or melaleuca. And so instead of the supplement facts, this says ingredients. These ones do not take internally. You can still do it topically on the skin and you can put it in a diffuser. There's multiple ways to use them. So just if you are going to get started with my little cheat sheet supplement, you can take internally. I've actually baked double chocolate peppermint brownies with the peppermint oil.
Lemon oil.
Because you can take it. Yeah.
So when Erica and I met, I was already using doTERRA because we have a lot of asthma and they have this blend called Breathe, and like it got us through. Oh my gosh, yes.
I brought it. I love it.
I'll be in the show notes because I know everyone wants these essential oils now. I can only speak to those two, but I do love them because they're pure. Because I don't know the statistic, but I think it's like as long as there's 10% of pure oil, anyone can say it's a pure oil. But it's 90% filler.
Because it has to have a long shelf life to sit at Walmart.
Exactly. Right. And
good to know.
But yeah, and I know some people like aren't huge fans of baths, but you can do Epsom salt soaks and put the oils in the Epsom salt first and stir it and then put it in the water because it lasts longer. And if you're not a bath person, get a diffuser. You can get them anywhere. Usually about right now, I've got what's called On Guard going. It's their blend of don't get sick business. And it's just
immune
all
booster
through the house. And it's an immune booster. We put it on our feet. My family is like, witch oils. And I'm like, you know what I mean? So they give me a lot of trouble. But when Erica and I met, I know she was like, how's she going to take this essential oil?
Because it's very witchcrafty sometimes.
I feel about essential. And I was like, essential oil. Yeah, we just nerded out. Imagine that. But with you, like you said, so we could do our hands, right? Because I know that's something that a lot of us start to cramp up with.
Topically, so if you're doing it, I don't know if anybody writes anymore. I'm sure it's all computer. But if you're typing, writing, I can attest for Nikki, we get a lot of pain in the forearms here. So if you take your arm and out by the elbow, if you mimic the typing, you'll feel that muscle. And a good way to do that with that frankincense. So if we're going to use it topically, whether or not you need the carrier oil, you're just going to take drop, put it on, rub it in, and then slowly, I'm going to try to turn. You're just going to strip up that muscle. So just doing pressure with the oil is like giving yourself a little massage, get those muscles loosened up, but then the oil's getting into that tissue while you do, which is really helpful to get the inflammation down and get that muscle. So you're getting the manual work, getting the muscle to calm down, and then you're getting the benefits of the oil actually getting into the cells and into those tissues to be like, okay, we can breathe for a minute.
So is the double peppermint brownie, that's part of self-care too, right?
Yes, I will have to go back and find, I'm sure it's lost in one of my Pinterest boards from 2014. I don't know where it's at. If I find it, I will send it to Nikki. I have not made them in forever, but as I was pulling out my oils, I was like, I have to tell them about these brownies. They were so good.
That would be my kind of self-care.
Yes. It's like baking's relaxing. So you can put some lavender in the diffuser. Yeah. Put some lavender in the diffuser. There's your anti-stress. Bake your brownies, put the peppermint in. You're getting good digestion from that. You're getting chocolate. Nobody hates that. And it's just all around good self-care.
Coffee or your tea, the lemon, the essential oil is going to be, I'm not a huge fan of all the pulp that goes into the citric fruits in my drinks, but like using the oil, you got to be careful. You got to make sure you read things.
Yes. And so as we come into cold and flu season, we're coming into the fall, I have tried so many different kinds of tea, and it tastes like dirty water to me. I'm not a fan, but I have tried, and I want to like it because I know how good it is for you. It's just the flavor is not there for me. That's okay. We're all different. But I make my own kind of tea, especially sore throat season. And what I'll do, is I'll boil some water. So get a mug full of hot water, put your honey in, and then I will do 1 drop, or even sometimes if it feels too potent, I'll just put a toothpick in it and swirl the toothpick around in my cup. And then I'll do a couple drops of lemon. And I also have a cinnamon essential oil that if I don't have that on hand, I'll just put a couple dashes of cinnamon. So it's like a tea, but more so I'm getting the benefits of taking the oil and supporting my immune system while soothing my throat. And it's kind of my best of both worlds. I drink the tea that I don't like the flavor too, but I get the benefits of the warm drink. That's one of my favorites in the fall.
We need all the help we can. We got to keep writing. So
Yeah.
got to keep us well and on target. And that sounds good. Can I add it? I love tea. Can I add it to my tea, or is there something you shouldn't mix?
No, you 100% can. I don't know what flavors would go best with what.
Okay, but it's just a flavor thing because I like herbal teas, so it's not, you could add it just to that.
So On Guard is a very spicy blend. So it actually has orange peel, clove bud, cinnamon, eucalyptus, and rosemary.
Yeah, see, that sounds really good with the peppermint cookies.
Yeah.
So what are your thoughts on standing? Like my desk, I'm always sitting when I'm on here, but I can also stand and work. Is that very beneficial? I know we switched gears there, but.
If you can do that, do that.
Okay.
Like I mentioned, we sit for so long, especially when you're in the groove. Getting up, being able to stand, getting the blood flowing, getting the body kind of moving, especially because while you're standing, you might sway a little bit or you could do some stretches and stuff. But if you can get a standing desk, 100%. That is fantastic. Yeah.
So we talked about writing. So I assume with reading, is it best to read standing like this? Is that what you're telling me, Eric?
I don't know. I sleep like this, wake up like this. And
My beverage, my blankie, my pillow. It's probably not very good for me body-wise, but I'll just use
I would say
after.
Yeah, it's fine. I would say reading is a form of self-care because we're relaxing. We're doing something we enjoy. We like it. I like to get cozied up with a blanket. I'm in the weirdest positions, not comfortable for very long, but comfortable for long enough to read. And I would say if that's the point, just maybe every chapter, do some stretches. You don't have to be walking around in perfect posture while you're doing it. Not feasible, not fun for anybody. Yeah. But yeah, if you're cozy and just doing what you're doing, then okay, drop it. And not even having to do the stretches where you're pulling, but do maybe just some gentle neck circles and just get everything moving for you again. Even just doing that while you're reading, just to keep everything loosened up and where you don't get super stiff while you're doing it.
Those are all really helpful hints because I know just trying to get myself to stop and remember to do it is a good thing. So do you recommend a timer on your computer or?
Yeah. Once again, it's person dependent. I'm notorious for I'll set a timer for something and then I don't want to listen to it and I'll stop it. I'm like, okay, I'll get to it in a second.
Okay, that won't help.
I forget to get back to it. So whenever works for you, sometimes setting a timer to remind you just, hey, do this quick stretch. Or sometimes what I'll do, which tends to work a little better for me, is I will put my phone away from me. So when I get that itch to, let's check my phone, be like, oh, it's not right here. I have to get up and go get it. So it makes me move around and not be so sedentary because I'm like, I heard my phone go off. Who's calling me? Who's texting me? Is my mom trying to FaceTime the baby? What's going on? Can't get to it right now. I know it's over here, but it forces me to get up and do some stretching with it. But really just finding what works for you.
I would bet the 2-year-old also is good at getting you up.
I don't sit much. At all. I'm so tired all the time.
So what you're saying, if we don't have a kid, just put the peppermint brownies in the furthest room from the office.
Put them in the other room. You'll go get them and then have a fan wafting it towards you.
Too bad they don't have chocolate.
Just torture yourself a little bit.
Oil. See, I couldn't do that.
Yeah.
I'd want to eat all the time. So,
yeah, that would be bad.
Sounds good. You're making me hungry.
I know. This is also helpful. Anything else you can leave us with just to keep in mind while we go write those bestsellers?
I think we pretty much covered kind of everything that I had in mind that I wanted to cover with you guys.
Awesome.
Well, we really appreciate it.
Thank you so much.
Yeah.
And we are all going to try to take better self-care. And all of this information is going to be in the show notes. So don't worry. Obviously, you're welcome to rewatch just to see if you get the techniques right, but we'll put some links in the show notes. So thank you so much for being here, Erica. We appreciate you.
You're welcome. Thank you for having me. And I will search tonight for that brownie recipe because now I kind of want to make them too.
You all heard it.
I will try to find that for you. They were so good.
Scotland's been late. It'll be in the show notes.
Perfect.
Thanks so much. All right. We'll see you next time on Wayward
Yeah.
Riders.
See